Welcome everyone to our first session of the 5th Digital Health Society Summit. This session is called The Power of Health Data Use, Real-World Applications, Example Finland. Today, we will explore the practical aspects of Finnish health data, covering the issues of availability, access, users, retrieval time, and costs. We want this to be a session where we share practical information that can inspire the others on what works, what could be improved, and how to make sure that the health data collected, gathered, processed is actually used for better health outcomes in the population. So we choose for this first session the example from Finland, as Finland is being considered a champion in this area. And we brought together the representatives of the data authority, pharma industry, and research organization to provide a fuller picture of the Finnish health data landscape, to understand how this ecosystem works and what elements make it successful. So we have 3 speakers at this session. Together with us today is Johanna Seppänen, who is the director of the Finnish Health Data Authority, Findata.
Hello.
We have Maija, who is Nordic real-world evidence lead at Novartis. And we have Jaakko Lähteenmäki, who is principal scientist at the VTT Technical Research Center of Finland. They all represent key players in the Finnish data landscape. And as I said, the aim of this session is to learn, to share, to uncover the transformative power of health data with insights that could reshape healthcare and research. So with this, I would like to maybe we know I'm sure that many of you know our speakers, but I would like them to tell us a bit more in their own words about their role and about their interest in the world of health data. Johanna, would you like to shortly introduce yourself?
Okay, thank you very much, and thank you for the kind invitation to speak and present Findata here. I'm the director of Findata, the one-stop shop for social and health data for secondary use here in Finland. We'll be up and running now for a couple of years, and I'll be happy to tell you a little bit more about the landscape, health data landscape here in Finland, and what are we doing.
Perfect, thank you. And Maija, would you like to introduce yourself and what brings you to this session?
Yes, thank you. And thank you also from my behalf on the invitation. So I'm the real-world evidence lead at Novartis Nordic organization. And I'm super excited about the possibilities we have in the Nordics, but particularly I think in Finland, driving really the capabilities on a Nordic level and on a European level also for creating real-world evidence that we do need for multiple things to complement, for example, the clinical trial data. But so happy to be here today.
Thank you. Great to have you here. And Jaakko?
Good morning, and thank you for the invitation to contribute to this summit. I'm Jaakko Lähteenmäki, principal scientist from the Technical Research Center of Finland, VTT. VTT is traditionally a data user, so we are doing data analytics for health, but nowadays also more and more contributing to the data spaces and infrastructures for sharing data. So I'm very interested on this topic and happy to be here. Thank you.
Perfect. Thank you so much. So as you see, we will hear from our 3 distinguished speakers today. We would like to first hear from each of them separately about their experience, about their work, about how they see the issue of the health data in Finland and how this ecosystem is working. And then we will also engage in a discussion, and I encourage you all in the audience to put your questions or comments in the box, in the Q&A box. So with this, I would like to invite Johanna to start on Findata, to tell us who can access data, how this all works, how much does it cost, and how we can really access data. So I think this will be like the big picture presentation on the framework, on the system that we currently have in Finland. So Johanna, the floor is yours.
Thank you, Karolina. Is it so that you are showing the slides and I don't have to take care about sharing?
Yes,
okay.
The slides are being shared, so you just have to guide us a bit how to. Yeah.
Fine. Okay. Can I have the next slide, please? There is the outline of my talk, as Karolina was telling you already. I'll be first telling you a little bit about the current status here in Finland, about the health data landscape, and about Findata services. Then I'll do my best to answer for the specific questions concerning the availability of data. So what data is there? What data are there available? How can it be accessed? And how much will it then cost? And how long would it then take possibly to get the data? But I'll go first from the very general point of view. So if I can have the next slide, it's about the cornerstones for secondary use in Finland. So secondary use of health data is actually nothing new here in Finland. It has taken place for more than 50 years already. We have a tradition of rich national data registers, also and particularly about health issues. They cover in practice the whole population. So I always use as an example the Finnish cancer registry that has all the cancers diagnosed in Finnish people since 1953. So 10 or more years after the Second World War, we already started to build up the registers, and of course they've been utilized more with the computers and with the computing power that we nowadays have. One important point is that we have the so-called opt-out principle in secondary use of social health data here in Finland. For those who are not familiar with the concept, it means that the health data that is collected from you when you use the health services, when you go to the doctor, when you've been diagnosed, when you use social services, when you go to the hospital, a lot of data is collected. It can be used for secondary purposes here in Finland without your consent. But of course, it needs a permission from an authority, and that's how we come to Findata then. But we don't need the consent from the citizens, but there is a possibility to opt out. So if you disagree, if you want to say, no, I don't want my data to be used for research, for example, you can opt out. And we have facilitated that process here in Findata. Very important and quite self-evident, but actually very important fact is that we have the key to link data from various registers, and that is the personal identity code. So each Finnish baby gets an personal identity code on the same day that he or she is born, and that is then used to link the data from various sources here in Finland. And of course, the last but not least is the high trust that we have for the time being here in the Finnish society, and people are trusting that the authorities taking care of their health data are keeping them safe, and they will benefit from the research. They've seen it happening with better medicine, better healthcare, better patient path, and so on. So that is a very sensitive thing. We are doing our best to take care that the trust remains. Next slide, please. What is the current status now? We've established a centralized health data access point, namely Findata, here in Finland. As I mentioned, the secondary use of health data is not a new thing, but it could be done even more. So the registers are very rich, and they could be utilized more and also for different purposes. And the aim for the centralized health data point is to improve and streamline the access to those health data. We've been up and running now for 3 years, a little bit more than 3 years. We started to operate in 2020, and operations are based on the Act on Secondary Use of Health and Social Data that took effect in 2019. And that act is a very particular one. I haven't heard that any other country has regulated on secondary use of social and health data. It's a lot. It has a lot of the same elements that the upcoming European health data space regulation will have. So, but the Act on Secondary Use of Health and Social Data is a national act we have here in Finland. It acts as a constitution for Findata, and it gives the mandate and the status that we have. We are an independent authority, positioned and located here in the Finnish Institute for Health and Welfare, steered by the Ministry of Social Affairs and Health. So we have a kind of a hybrid position here with 2 different steering bodies. We are a non-profit organization, as authorities in Finland are. Our budget is growing. It's nowadays a little bit more than 3 million euros about, and we have about 30% staff currently on board. Can I have the next slide, please? So what do we do here in Findata? What are our services? We grant data permits for health data, always when you need data from multiple controllers, or always when you need data from healthcare units that are operated on the private sector, and always when you need data from Kanta services, which I'm not going in depth here because of the limited time, but it's an electronic health record system we have here in Finland. After granting the permit for you, we will then send sampling requests to the registers, data controllers. We will collect the data, link it using the key I mentioned, and then pseudonymize or anonymize it depending on the case. We also produce aggregated data. So instead of ordering individual level data, you can also order ready-made statistics on request. We have a legal task to maintain and secure IT environment for all these actions, for clients to apply data, for us to manage data, and for us and registers or data controllers to transfer the data in a secure way. And we are also providing the secure remote access system Kapseli. It's called Kapseli for data analysis. And so the customers can analyze the data there. We provide the most popular most used statistical packages there, and so on. Last but not least, we have a help desk for data users, which has been very popular since we started. So there is one single point in Finland where you can ask about the availability of health data, about the suitability of the data for your purposes, about the quality, about the costs, and so on. And it has been indeed used a lot. We also have an anonymization services, and we also issue some guidelines and regulations for the whole research development and innovation infrastructure here in Finland. May I have the next slide, please? Oh, this is a quick, simple illustration about how the things were before and what has been changed since we started. So before, if you needed data for 3 different data controllers or 10 or 20, you were then had to apply all of them separately. So you had to send 3 different applications for 3 different registers. The processes were not standardized. The application forms were very heterogeneous. The prices were not predictable, and so on. It was considered also very time consuming. It could take more than a year for you to get the data from the registers. So with the Act on Secondary Use, this wanted to be streamlined, and Findata was established. And now what the researchers need to do if they need data from several registers, they just made one application in our application system. We will then handle it, and we will then contact the data controllers and ask for the data and collect and link it for you to be used. So from that illustration is also visible that we are centralized what comes to the application, but we are not centralized with the data. So data is collected each time for each study project separately, from tailor-made from the registers. Next slide, please. Okay, some words then about the data access and discovery. Could I have the next slide? This is the big picture of the database, so to say, that can be accessed through Findata. So there is, I mentioned that there is a lot of data collected in everyday social and healthcare services. All that data can be accessed through us. So we have the mandate to permit all the data that is collected in the Finnish healthcare system. The patient records are the very core of this. They are asked a lot. Also, the e-prescriptions. Findata has all the prescriptions in electronic form since 2017. And then there is the data from social and welfare services also. And all this has the coverage of the whole Finnish population. Then we have the national registers, mainly maintained here at the Finnish Institute for Health and Welfare. And the green shady box is for the biobanks and genome data that is currently not included in the secondary act and in Findata's operations. But at least the current versions of European Health Data Space regulations are including also biobank and genome data. So we will see what happens with that kind of data access. Can I have the next slide, please? There is more detailed list of the organizations that are having the the national health data registers. The biggest I mentioned is the Finnish Institute for Health and Welfare. It has at least, I think, 24, 25 official registers, and then a lot of more wide population-based surveys and so on that can be also accessed through us. And then there is the social healthcare service providers from private sector, the Kanta services I mentioned. Then there's also the social insurance institution, the Finnish digital agency that actually is not about health data, but it is about the important background variables that are often needed when you do register-based research. There are some pension data from the Finnish Center for Pensions, Finnish Medicine Agency. Occupational health data is provided by the Finnish Institute of Occupational Health. There is Statistics Finland joining with the cause of death data. And then there is some authority data from supervisors and state administrative agencies. Okay, more information can be obtained via our website. There is a lot of data behind this slide, but I'm not going into the detail. Next slide, please. Some words about the metadata catalog. So we have the task to build up a metadata catalog that would then serve the data users and researchers. The data catalog will then have all the data that is available in Finland and describe it. There is now 39 data controllers that have described their data in the catalog that can be accessed through our website. There is still more to do, a lot to do, more controllers that haven't. But this is work that has been started before Findata, now led by us, but it's more like a marathon than a short run. But it's the data catalog is getting richer month by month, and one day we will have all the data in the catalog, and we can also then have more modern services for the clients to be able to pick up the variables like you do in the shopping car when you do shoppings in online or things like that can be developed once we have the data described in the catalog. Next slide, please. So how to access the data? And I mentioned there is individual level data and aggregated data available. You always need to present a utilization plan when you are doing research. A research plan serves as that document. And the data is there is like the one specific purpose rule. So it's permitted always for one specific purpose for certain persons for a certain time period. And if you need the data for another purposes, then you should apply it again. So it's not, there are not permits available for permanent storage or so, but it's always for one project, and then the permit time will be over one day. Can I have the next slide, please? I don't know what about the time, if I have exceeded it already.
I think we are going to the end of the time for this.
Okay, so next, here is our customer path. I'm not going into the detail. Next slide, please. The duration depends a lot about the complexity of your application, but all the applications are checked within 1 week of submission. So within 1 week you will get some information back if you need to provide more information, or if your application is sufficient to be handled and is going to the queue. There is the queue, and there is the processing of the application, duration of which is very dependent on the amount of data controllers that are involved. And after the permit, there is the extracting and compiling of data phase. All of this is now estimated to take about 9 months, 8 to 9 months. The queue is getting shorter and shorter all the time. So I think it will be even shorter, I hope already next year. The amendments of the permits, there is practically no queue currently, so you can have it even in 1 week. 6 weeks is long nowadays, so if you need an amendment, it's 1 or 2 weeks. I don't know, perhaps if you can jump for a couple of slides to the pricing. I promised to say something about the pricing. In Findata, a public body, an authority, is not allowed to decide on the prices itself, but we receive a decree from the Ministry of Social Affairs and Health that states the prices of our services. This year, prices are listed there on the table, but there are 4 different elements that sum up the total price. So there is the permit fee for Findata, there is the sample costs that are reimbursed by the data controllers. Then there is the data management work we do here in Findata by linking, collecting the data, and then there is the Capseli environment payments. The Capseli is presented in next slide, so if I can still show that. So there is the situation in October. In Capseli, we have total of 139 projects and more than 1,000 users in Capseli, and the packages are quite evenly distributed between small, medium, and large. You can read more about Capseli and all actually all the things I've been telling at our website. I think I have used my time already, so thank you, and I'll do my best to answer for your questions later if there is any.
Thank you, Johanna, so much for this comprehensive presentation. I think when we were planning for this session, we agreed that you could spend even more time to share about Findata. It is, of course, like the whole system. So there are so many different details and issues that I'm sure our audience is interested. I received a couple of questions from our audience. There are small questions, but like, let's say, technical or practical. So perhaps you can quickly also address them. First of about the time, I had a question about how much time does it take, but you addressed this already, 8 to 9 months, you said. There was a question if the individual citizen can request or apply for the data access. So this is very technical. Then one is the question also about how many % of the Finnish citizens go for the opt-out option. Can you quickly comment on those two?
Okay, thank you. So there is no restrictions about who can access, so everybody can apply. But then we are looking at the data security and data safety issues, and about your utilization plan, that it's in accordance with the purposes of the Secondary Act, and also individual persons, it has also happened that they can have the permit and they can have the data. Also, you don't need to be a Finnish citizen. You can be from abroad. You don't even have to have an affiliation here in Finland. Mm-hmm. There are totally non-Finnish research groups that are working in Kapseli and using Finnish register data. And the other question was about the number of opt-out.
Yeah. Mm-hmm.
There is currently 222, I think, citizens that have been opting out. So
220 out of 5 million plus.
5.6 million people. So in practice, all the Finns are in.
All right. So maybe also one word on if there is a specific data model used to facilitate federated data analysis. How are those data from different registries are being
federated? With federated, you mean that the data is not moving, but it's staying in each registry. It's not facilitated here from Findata, but there is the OMOP, if that is familiar, the OMOP model that is used, for example, by the biggest university hospitals. They are doing federated analysis with OMOP model data.
Okay, so actually OMOP was mentioned in this question as the example. So thank you so much. Thank you, Johanna. We will come back also to other questions after we hear from Jaakko and Maija. We would like now to hear a bit more from the other side, from the data users. So I would like to invite Jaakko Lähteenmäki from the VTT Technical Center to share his experience with health data use in Finland, to how to process data for different purposes. So Jaakko, I know you have a presentation. Okay, you are now sharing, so the floor is yours.
Okay, you see it now?
Yes, we do.
Okay, so I will present a use case where we have used real-world data for improving the elderly services. So highlighting also the importance of social data besides health data. This slide is to motivate that we focus on elderly people, because they really consume a lot of services, and if you want to reduce spending in public healthcare and social services, it's a very good group to focus. And we also know that about 10% of the people may use up to 60% of all services. So it's important to identify actually those people who could be helped proactively. So this project addresses the possibility to use data for developing a machine learning model that would identify the people at risk of excessive use of services. And then, of course, the other thing is that when we identify those persons, we could use that to focus preventive services for those groups. Together with us in the project, we had Finnish Institute for Health and Welfare leading the project. And we also had the Lapland University and Helsinki University. In particular, the Lapland University was doing also the analysis of the legal aspects related to this kind of services, this kind of use of data in the operational service. And the idea of the model is visualized here. So we think about a general model that could help in the individual, when we meet individual customers, but also we could use that for population level service management and planning. And that would, of course, require access to the national and regional data sources. But in order to develop this kind of a machine learning model, we would really need the secondary use of data to do that. And in this slide, we show the data that in this case, we were using, we had a range of 70 to 90 years of age persons. Altogether, 33,000 people were involved here. And this region was a region in Finland, Päijät-Häme Wellbeing Services County. Actually, all those persons of that age from that area were in the study, and we used data for 4 years to train this kind of a model, and having all the encounter data of healthcare and social care services use, and also social services decisions, and also the so-called RAI assessments of the people. And we used machine learning model technologies, logistic regression, and XGBoost. And it goes like Johanna already told about this Findata capsule, and under this legislation, we need to process the data in this kind of closed environment. In this case, we were applying only the data from one register controller, so we went directly to apply that from this district. But we could as well have used Findata for applying the data. In this case, we used Findata only for the capsule side, so the data was processed there, and as shown here, we get then pseudonymized data access to this capsule, and our experiences from that service is rather good. So we are quite happy with that service, and the approach of modeling was that we tried to use the data from 3 past years to predict what happens during the 4th year for the individual. So whether there is an excessive amount of services used. And one important aspect in this kind of work is that we have all the time the social and health professionals in the project, and in this case it means that we had them already in the beginning to define the objectives of the study and what kind of service they would need, and or what kind of tools they would need in the operational phase. For that reason, we also found it important to create a demonstrator or a test user interface for the professionals to test. And this is visualized here, the main components of that proof of concept service that we developed based on that machine learning model. First of all, we have the possibility to view the data on map application, what the base data that we are using in the model, and then on the right hand side there is a visualization of how the results of this analysis can be shown to the professionals, and how we can extract, for example, here in yellow, we can extract the risk groups that have the highest risk for excessive amount of service use. So that's also one thing is also that this user interface allows the professionals to analyze which are the factors that affect the service use. So we call that the explainable AI, which is very important in this kind of service, that the professional need to understand where the predictions come from, not only the result, but also the reasons, so that they can really think what are the correct interventions that would help. So this was an example, just an example. We have also other projects ongoing, but this is the main things of this study is that we really have found that it's important to focus on the preventive services if we want to affect the costs of health and social services. And there it's important to really have the social side also represented, not only health. And then finally, the one thing is that we need to have very close contact during this kind of a project with all the end users, so the health and social care professionals, to be aligned with their expectations. And maybe one more thing or observation of this was that our use of data in this was very successful. The whole project took 2 years, but we also got quite a fast access to the data and no big problems in using the Capsuli service. So we are happy with that. So I think this is all. I have used my time. Thank you.
Thank you, Jaakko. And you also actually responded to my question, because I wanted to ask if having Findata and having this Findata services has improved your life as a researcher. And you said that it was a pretty easy process to access data. Yeah, actually, as I said, in this case, we applied the permit from this district. It's Päijät-Häme district, but Findata service was in this project. It was this Capsuli service, but we are happy with that, and we have also used Findata for other projects, and of course we always want to have faster processing of the applications, but I see that it is improving all the time. Great. Thank you so much for sharing your experience and sharing this use case. Maybe before we go to Maija, maybe you still want to, you said like about those positive sides. Do you want to maybe comment on some, like what could be the obstacles in using data and AI to improve the cost efficiency in healthcare? Yeah, maybe one obstacle is still the legislation about concerning the operational use of this kind of machine learning predictor. So it's not clear how we can actually proactively contact, for example, the people, and how we can use the data in this kind of setting. And there are different interpretations about this legislation. So there would be need for more guidance to also the healthcare providers, health and social care providers, of how they can use machine learning and AI in the services. All right, perhaps we will have a chance to come back to this after we hear from Maija and see what would be the potential solutions. So with this, I would like thank you Jaakko for sharing. I would like to move to Maija Wolf, and as I said, Maija joins us from Novartis, Finland. She's a Nordic real-world evidence lead, and she will share her experience from the representative of the pharmaceutical company. So I assume, of course, that you work a lot with health data, and yeah, looking forward to hear from you.
Thank you, Karolina. And yes, so while we are waiting for the slides to come up, I will, in this presentation, really provide some views on those elements that make Finland an attractive country for real-world evidence generation, and really from the perspective of a pharmaceutical company, and particularly for studies with secondary use of data and studies utilizing biobank samples. Is it possible to have the slides on a presenter view, if possible? But when we can then also go to the next slide when available. So Novartis is an integrated, focused, innovative medicines company and highly committed to research and innovation. Thank you. We can go to the next one. And in general and across pharma industry, there is an increasing need for real-world data to complement the evidence which is generated in clinical trials. And to tackle that need, at Novartis Nordic organization, we have a separate unit to facilitate such activities and to transform the data into real-world evidence. And the use purposes for us are typically to optimize the drug development process, to ensure and facilitate patient access to innovative solutions, and also to really improve medical practices. And all the Nordic countries offer very good opportunities for conducting RVE studies, and we currently have more than 50 studies in active planning and execution across the Nordics. And these also include several studies that are directly involving our global Novartis organization. But then in the next slide, I wanted to address some of the success factors that make Finland specifically attractive for conducting real-world evidence studies. And the first is the rich data landscape, along with the high-quality samples that are stored in the biobanks. The second one is as we have heard earlier, the enabling infrastructure and the enabling processes to access and use the data and the samples. And as for third, I want to highlight the collaborative mindset that we have in Finland and the several public-private research ecosystems that provide also pharmaceutical companies a great possibility to tackle bigger scientific questions together with academic partners and stakeholders of the healthcare system. And then as for the fourth, it is the basis really for these capabilities that we have today are the result of the government's prioritization and being very systematic on that over several years, investing into the infrastructure. And finally, and most importantly, and this is also something that has been brought up in the earlier presentations, it is really the trust of the citizens that is fundamental for all the health data related activities in Finland. But then to be more specific on the first two factors, and we can go to the next slide, it is really the longitudinal and linkable data in the registries and in the data lakes, the hospital data lakes, as well as the samples within the biobanks that build the potential for Finland. But only together with the legislation and the processes for approval and access, that potential is realized. So in Finland, and as we heard from Johanna Seppänen, we have the Findata for the secondary use of data, while the Finnish Biobank Cooperative of FinBB and the associated FinGenius ecosystem, they serve as a single door solution for the biobank studies governed by the Biobank Act currently. So having this clarity and predictability in the processes, as well as understanding what data elements and how many samples per indication are available in the biobanks, is really critically important for us in a pharma company when considering new research investments to Finland. But then to move forward, I will in the next slide want to mention two concrete examples to illustrate what these success factors enable. And the first one is the FinGen project, which is the largest biobank study in Finland and among the largest in the world. So FinGen is a public-private partnership. It has brought together academic and biobank partners, as well as a very significant number of international pharma companies to build a unique data set with genotyping data from approximately 10% of the whole Finnish population. That's 500,000 Finns, and linking that genotyping data with national health register data. So FinGen delves into understanding the genetic mechanisms of diseases and their development and progression. And by increasing that knowledge, it has the potential to lead into more effective prevention, better diagnostics, and better treatment. And merely to illustrate the level of activities, only during last month or October, results from close to 50 studies were published from the FinGen dataset. Novartis has been part of the FinGen study since 2020 and continues to be involved in the phase 3 that has just started and which is also the main analysis phase of the project. And we can move to the next one. My second example is from a biobank study conducted locally to address the evidence needs in advanced breast cancer. And this study was conducted in 2 phases. First, looking into the retrospective register data from the one hospital district, and then assessing the distribution of the different advanced breast cancer subtypes and their incidences and patient treatment patterns and survival. And then the second phase included sequencing for specific mutations from the tissue samples and that were available in the hospital biobank from these included individuals. So the key success factors for conducting this study were really the availability and accessibility of clinical data through the hospital data lake, as well as the availability and accessibility to good quality tissue specimens from the hospital biobank. And the data itself was published earlier this year. But next I will conclude with one slide. And these are topics as success factors for the future, including those of the EHDS. So I wanted to raise the need to continue the development of the enabling infrastructure. We still have work to do with the processes, with study feasibilities, or having the catalogs, as Johanna Seppänen mentioned, more complete, ensuring that the access times are reasonable and making sure we are able to participate into international collaboration efforts. And secondly, we need to really secure the competitiveness of Europe through the EHDS and the EU pharma legislation. This is coming now thinking the perspective of also pharmaceutical company. So the future of Finland's capabilities and the European capabilities are fully interlinked. And thirdly, we need to ensure that the data is effectively used to benefit individuals and societies for increasing the well-being of individuals and building up a sustainable value-based healthcare systems. And we know there is enormous pressure nowadays on healthcare systems around the world, including also in Finland. And we really need to make sure that by investing into the use of data, we should, as Jaakko also pointed out, we should aim at preventing those diseases that are preventable and have then also the capacity and capability to treat those with innovative medicines, those patients that are in need of more care. And I will finish here. Thank you.
Yeah, perfect. Thank you, Maija, so much for this presentation. Maybe linking then to what you said at the end and what Jaakko started. What do you think would be the most effective activity that could actually help us increase those benefits for the individuals and the society? What do you think could be improved also in relation to, well, Jaakko mentioned the EU legislation could be improved here.
Yes, I think also the legislation, I think as Jaakko mentioned, we are not able to do primary prevention at the moment in Finland. So until an individual is on a care pathway, there are no tools to kind of go forward with the primary prevention. And this is probably something that needs to be solved, considering the enormous potential and the power of the data, really. And but I think also coming back to the trust of individuals, that is a main topic also for the future.
Yeah. Perfect. Thank you so much. And there is again so many things to discuss here. We have 3 minutes, and I have 2 questions to all of you. So I would like to maybe just hear a quick responses from you. you presented quite optimistic and positive vision, and that I'm very grateful for that. It's great to hear that there are things that work and the systems that actually bring value and are well structured. Is there anything you would wish like for the improvement in the next 3-5 years from Findata, from the secondary use of health data in Finland? Something that you wish for? Quick responses from all of you. Johanna?
Yes, if I can raise one point, I think it would be the money. So the reimburses and the prices for permits are same for everyone, and there is a discussion, and there should be more, even much more discussion in the Finnish society. What is the cost of health data, and who is responsible for paying it? Is it for the taxpayers, or should it be the clients? And the discussion should go on until we find an satisfactory compromise for all the bodies. That is my wish.
What about you, Jaakko?
One thing concerns the ESDS implementation. I really hope it will be a reality in the future as it is planned. The challenge is maybe that there are different ideas in different countries what it means, and different practices. So I really hope that the EHS comes and harmonizes the approach to sharing data.
Thank you. And what about you, Maija?
So very briefly for Finland, particularly, I think we can do more to improve the kind of the tools for feasibility studies, to understanding exactly how many individuals are available with certain diagnosis and data. So this is a very concrete example. But then from a bigger perspective, and thinking about the future and EHDS, I really hope Europe is able to really maintain the competitive edge, and that the primary use of data and data collection is done so well that it ensures a good quality secondary use going forward.
Perfect.
Also.
Thank you so much. I'm afraid we need to finish here. And I would like to thank you all for sharing your expertise and your stories, and building onto this fuller picture of the Finnish health data landscape. After a very short technical break, we will hear from the French example. So we will hear how this issue is handled in France under the French legislation. I would like to congratulate and thank all of my speakers, Johanna, Maija, and Jaakko. And if you have any questions and issues, please contact us or our speakers through, for example, LinkedIn. Thank you so much. Goodbye.